Jessica. I'm a child life specialist on pediatrics and the pediatric intensive care unit. I have been working at our hospital for 5 years. I love this unit because I really feel like I get to see everything. For our direct admits, they may need an IV start, some lab draws. We may run down to CT for a scan. For radiology patients that come in, I may follow them down for a VCUG or an MRI or an X-ray. And I even follow our kids down to surgery. So I feel like I really get my hand in a lot of different places, and I also get really good at the spiels. So what I mean by that is I get really good at the preparation aspect for each developmental level. And one of my favorite preparations to do, honest to God, is just an IV start. I love how it's very medical play focused. I love that they get to see and touch and feel all the things in real time and ask questions. My favorite age to prepare is the preschool and the school age because I feel like they are learning to grasp some of these concepts in a developmentally appropriate way, and they can understand their job versus like the infants that you're honestly just gonna support and distract, or the toddlers that you're just like, let's do this, let's get it done so we can return the child to baseline. The preschool, school age, they're gonna ask those questions. They're gonna pay attention to the preparation that you're doing, and I think that that is so, so fun. So one of the first things that I do when I'm preparing for an IV start for a preschool or school age child is I'll see if they have a stuffed animal already in their room. If they don't, then I will provide one for them. So today we're gonna be using Lammy. I usually don't use a stuffed animal this big. He's almost as big as me, but I just thought for this we would use a bigger one so you can see. So the first thing that I will do when talking to the preschool or the school age child is talk about what brought them to the hospital. Why are they here? Usually they'll say, I don't feel good, or my tummy hurts, and we'll talk about the ways that they take medicine when they're at home. They'll usually tell me that they drink their medicine or their mommy squirts their medicine in their mouth. And I'll talk about how at the hospital we take our medicine a little bit differently, and how we take them is right through our blue lines. And so I'll usually show them my blue lines, and then immediately they'll be looking for their blue lines. But this is literally the only spot on my body that you can see the blue lines because I am a horrible stick. So we'll talk about the blue lines and how they carry blood, but that they also carry medicine. And so there's a very special way at the hospital that we can give our little blue lines medicine. So the first thing that I'll show them is our stretchy, stretchy rubber band and how this is gonna go around their arm. So we'll take Lammy, scoot back a little bit, and I'll tie it around his arm, and I'll tell them that it's gonna give their arm a tight, tight squeeze. And so usually a kid, if they're like really engaging in the preparation, will be like, why do you need to do that? And so I'll explain to them that when you see my blue lines as they are, they're kind of flat, but if I squeeze my arm really, really tight, you can see so, so much more of them. So they'll squeeze their arm, they'll squeeze it really tight, and so I'll say the nurses just like to use this so they don't have to squeeze your arm super, super tight. They'll use this, and that way it'll be able to stay. So with that then, we'll start to look for their blue lines. And when they find a good blue line, what they're gonna do next is they're gonna clean it. So we wanna make sure that there's no germs on top of the blue line. So I'll tell them usually they can touch it so they can feel what it feels like. It's cold, it's wet, it doesn't smell very good, and we'll rub, rub, rub to clean the spot. So rub, 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 clean, clean, clean. And then what we'll do is I usually carry my IV right on my badge, and so that's an easy way for me to just right away show them what it looks like, but I brought this one so you can see it a little closer too. So we'll talk about this tiny, tiny little straw, usually big enough that a Barbie doll or a superhero action figure could drink apple juice out of it. Super, super tiny, but it's the perfect size to fit perfectly right into our blue lines. And so the way that this one works is it's a straw, but it doesn't go through my skin. Not right now, at least. So when the nurses do it, there is a teeny tiny little poke, so tiny that it would have to fit inside this little straw. So, so tiny. And what that's gonna do is it's gonna help go through your skin into your blue line, and then that pokey part is gonna come all the way out. The nurses are gonna throw it away, and the only thing that's gonna be in there is just your little straw. So the poke is just to help us get to your blue line. So once we talk about that, some kids are like, oh, okay, cool. And some kids are like, wait, what? And so we have to do a lot more talking, but it just depends, and usually the kids will guide that conversation for me to how much information they need. And sometimes we will talk about the syringe. So we'll talk about this and how this is what connects, just like Legos, to the straw. And that way they can push medicine through it and they can take blood out. And sometimes they take blood out of your body so that they can see how the inside of your body is feeling. And so I'll talk about how blood can tell us how the inside of your body is feeling too. So especially if kids are like, I don't feel sick. Well, sometimes our outside of our body doesn't feel sick, but the inside of our body does. And so that's what the blood helps tell us. So we'll talk about connecting it just like Legos and being able to push and pull, and that usually helps with the misconception of like the needle is definitely still in there. It's not, because if it was, I wouldn't be able to push anything or pull anything through it. So sometimes I'll fill this up with water, and we'll be able to squirt it all the way through so they can see like there's nothing in this and there won't be anything in it when the nurse is done too. Sometimes, depending on how much information the kid needs, we might talk about the little pillow that'll be put on their arm. The little pillow is just to help their arm stay straight so that the blue line doesn't bend or anything like that. Some of our preschool and school age kids don't always need that, but it just depends if they're a hard stick and the nurse is like, we gotta save this for all it's worth. We may talk about that just later. But then usually too, I will talk to them about what their job is during the procedure and things that they can be doing to help distract or cope through it. And so I'll give lots and lots of choices because that's exactly what kids need. So I hope this was a little bit helpful and you learned a bit. Have a great rest of your day.